I am Anissa. I am currently in New Orleans. I moved here from Portland, Oregon. I am a fourth semester MSW student at Tulane School of Social Work, and my placement is Tulane Abdominal Transplant Clinic. So at the transplant clinic, it's a medical social work position. I do both inpatient and outpatient services. So I'm there Monday, Wednesday, Friday. Monday and Wednesday, I have clinic hours where patients that are either seeking a transplant or may have already had a transplant but would like to see me come and see me. Part of the criteria for organ transplantation, if you are interested in one, is that you must meet with a social worker. So I fill that role. And patients, when they see me, they are coming to us because they are physically ill. So unlike a lot of other placements, they're not coming to us for mental health services. But a lot of what I do is really connecting the here and now for patients. When doctors see them, it's really easy for patients to get kind of lost in the hubbub of making sure they're okay, making sure that organ is okay, and kind of pushing them through the process to listing. And when I see patients, it's like, let's stop. How are you doing? This is a lot. This is life-changing. Are you okay? Or is there anything that we should be aware of that might help you better prepare for this? And also what I do during those is I look for any, I hate to use this phrase, but red flags that might come up afterwards. Is there symptoms of depression that they have not seen somebody for? Is there going to be an issue within the family, because we need them to have solid caregiving and solid family support afterwards? Is that going to become an issue later? And after I gather all that information, I present it to the selection team on Fridays, and we as a team decide whether or not they should be approved for listing for an organ. On the inpatient side, I work with individuals that have either recently been transplanted and are in the hospital to recover from the surgery, or people that are previous transplant patients that have come back for some sort of a medical issue. And while I'm there, I really just do a lot of the case management on that end. Are they going to need home health? Are they going to need a walker? Are they going to need this or that? Just checking in and saying, hi, how are you? Are they going to need dialysis later, and connecting with their dialysis social worker as well. And lastly, part of what we do too is working with healthy people that are looking to donate an organ to their family member, to their friend, to their neighbor. So part of my job too, which is really interesting, is that I also assess healthy people to see if they're qualified to provide an organ for somebody, and how is that going to impact them? Are they going to have feelings of personal guilt if the organ doesn't take? Is this going to create is this going to be a burden on them later on, financially, medically? And I'm just kind of being that person that looks out and is like, all right, down the road, are we all going to still be okay? I have a personal connection to transplant procedure. So when I saw that transplant was an option, I knew I wanted to do it. And I'm really happy I did. One of the things that you learn in transplant is really how to have those conversations with people to get as much information as possible without really feeling like you're prying into it. You really learn how to, do a good assessment while still keeping the conversation flowing and light, and not making it feel like you're judging someone else. The other thing too is that medical social work is a very marketable skill to have. Knowing how to do case management, knowing how to do requisitions, knowing how to refer somebody out, that's all super marketable, but sometimes it can feel a little tedious. So being able to do that while also having that patient contact aspect of the outpatient, I feel like has prepared me to be a social worker in any kind of medical setting, or honestly any kind of addiction setting as well, because it just ties in, especially with liver disease management and liver transplants. We see a lot of people coming to us with alcoholism or, with hepatitis that came from intravenous drug use. And so we are so intertwined with so many other disciplines that working in transplant, I really feel like has prepared me for any kind of medical social work.